Hi, my name is Dr. Lucy Meyer from Third Coast Foot and Ankle, and I'm here to answer that magic question of if I have an ingrown toenail procedure, will it be gone forever or could it come back? Now, when we have an ingrown toenail procedure, most commonly what we are doing is removing a portion of the toenail, the part that's digging underneath the skin that is causing pain. And then once that nail is removed, we place a small amount of medicine at the root of the nail. That medicine that we're placing there is actually meant to kill the root in that specific small area to prevent the toenail from growing back again. So yes, if you have an ingrown toenail procedure, we expect the ingrown not to return. Now, there are some caveats to that. We cannot guarantee it and say it's 100%, and this is why. Sometimes that medicine just simply doesn't work. It is dosage dependent, and most of the time if it fails, what happens is there's little small spicules or there's just some tiny cells trying to push some nail out. If that occurs, typically you will notice pain and swelling around the nail bed, so like closer down by the cuticle, but it usually doesn't happen until like 3 months or later after the procedure. This is relatively rare, but we have seen it. And so if you do notice some discomfort months after your procedure that seems to be coming out of nowhere, that is a sign that that medicine possibly didn't take completely and we have some nail trying to grow back. Other reasons why the medicine might fail is if there's infection. If there's an infection when we apply the medicine, it most of the time still works, but the infection also changes the pH in the area, which causes the medication to be just a little bit less effective. And so there is a chance with infection, or a higher chance with infection, that that medicine won't work. Now, if the medicine does work and there's no nail growing back, you should be in the clear, but there's always issues down the road where if the skin is pushing up against the nail, or if you have an injury to the nail and the nail continues to change, we can see ingrown toenails recurring. Some of this is because of genetics and some of it is just because of bad luck. We see a higher incidence of returning ingrown toenails in athletes or anybody that's just actively wearing tight shoes or very, very active on their feet. Overall, I would say it's very rare, and statistically journals say about less than 10% of patients that have ingrown toenail procedures need to have them repeated down the road. So if you are looking into having an ingrown toenail, or maybe you've had one and you're concerned that maybe it's coming back, these are the options for you to explore. And if you're having pain, please reach out to your podiatrist, or here at Third Coast Foot and Ankle, we'd be happy to help you out and make sure that your toenail is pain-free.